Hi, everyone. My name is Sydney Barnett. Thank you for the opportunity to talk to you on this LinkedIn Live about lung cancer and research and all that I'm looking forward to ahead. My connection to lung cancer is that I am a stage 4 lung cancer survivor. I was diagnosed probably almost 7 years ago, while I was going through my medical residency. I am also an internal medicine physician, and a hospitalist. Um, this is just, so amazing that I'm able to talk about this experience because it has really touched who I am and is really the reason why I'm alive today. I started having a cough and I had some shortness of breath. I went to get an x-ray done and it showed what we call a consolidation. Is just the left lower lobe was completely white on the image. And they originally thought I had a pneumonia and treated me as such. And when my symptoms weren't resolving, I decided that I would see a pulmonologist who said, oh, you probably have hyperactive airway disease. Here are some steroids. Um, I was in the middle of moving to the States at the time. So when I started internship, I had said I would see a pulmonologist. When I began wheezing, I decided that I needed to speed the process up. And lo and behold, after repeating an x-ray again, they still saw the same, abnormality. However, it was smaller. I requested a CT just for the fact that I was concerned that the abnormality was still there at this point in time, would have been a year later. And the CT showed that there was a mass compressing my airway, and that was the reason I was wheezing. So after a whirlwind of tests, I think that between the X-ray that saw the same consolidation to the bronchoscopy to getting referred to a tertiary center and having repeat bronchoscopy and other workup was a month. And I was then told that I had stage 4 lung cancer. Thankfully, they sent my tumor for biomarker testing. I was found to have a biomarker called ALK, and I was started on targeted therapies right away, which I responded well to. Um, I think probably about a year ago, I had progression, and they were able to move me to another medication that was able to take care of that progression. And for right now, I have, no evidence of disease, and I'm looking forward to the future. And that's the reason why I think research is so important. Biomarkers are so important because I would not be able to live such a functional life, being able to work full time, being able to work out, being able to spend time with my friends and family if it wasn't for the fact that research made biomarkers possible.
Hello, everyone. My name is Dr. Takara Scott, and I am a medical science liaison with Foundation Medicine. Today, I have with me Department Chair, Program Leader, Senior Member Dr. Jhanelle Gray, who is a thoracic oncologist at Moffitt Cancer Center, and Dr. Basu, Executive Director of Research at LUNGevity Foundation. I really want to first start off with a special thank you to Dr. Sydney Barn, who is a lung cancer survivor as well as a physician, for sharing her patient's perspective in our introductory message. Before we jump right on into today's topic, I must share the disclosure that the views contained in this panel discussion are provided by the panelists in their individual capacity and are not meant to serve as medical advice. The opinions expressed in this panel discussion are the panelists' own and do not reflect the views of Foundation Medicine, Inc. or the panelist employers. Now that we've gotten that out of the way, I am really excited for today's discussion as we focus in on disparities in lung cancer care. We are expecting to cover at a high level some of the historical barriers around care for lung cancer for racial, ethnic, or social or other social demographic groups, current research that is being done in that space, initiatives that are being conducted to ensure that more inclusive strategies are being implemented to really achieve and sustain health equity to really in order to really help eliminate disparities for patients with cancer. At the end of the session, there will be a 15-minute question and answer in the comment section of the LinkedIn page. It's super important, although sometimes we have to admit uh, a bit uncomfortable, that we are able to sit and have these discussions and consider ethnic backgrounds as we strive to transform cancer care as a whole. We know from studies that lung cancer can have varying effects on different ethnic backgrounds. For instance, lung cancer tends to affect Black Americans, particularly Black men, differently than their white counterparts. In fact, Black men are 11% more likely to be diagnosed with lung cancer, with about 9.8% of them actually dying from the disease. Black patients are more likely to present with non-small cell lung cancer and again have a lower survival rate than their white patients, than their white counterparts. This may likely be due to multiple barriers that contribute to notable disparities in treatments for Black patients. In other populations, we see 15% of Latino Americans with lung cancer less likely to be diagnosed early, 16% in the Asian American or Pacific Islander populations. So, Dr. Gray, I would like to start with you with the first question. What are some historical barriers that have impacted the way different racial, ethnic, and socio-demographic groups have been treated as it pertains to lung cancer treatment options?
Yeah, so I think that's a wonderful question. And as you mentioned before, we have the statistics, but even though with the numbers, we have to understand what is driving those numbers forward. And so demographics, socioeconomics are things that we definitely take into consideration when trying to address those. We want to look at education, we want to look at access, and we want to be able to drive forward with quality healthcare. One of the things that we definitely take into account is a patient's insurance status and whether or not they're uninsured, which means they have no insurance, or even some patients we think who are underinsured. A lot of this will correlate with whether or not you can go to certain facilities, whether or not you will get certain workups covered, and so forth, so that we can do the best that we can as far as moving your treatment forward. There's also, proximity where certain populations are located, where they live, as opposed to where, well, let's say where perhaps a comprehensive medical center may be located, and the travel, right? That transportation, that distance, taking time off of work. All of those also can be burdensome to the patient and impact the ability for us to deliver really what we are seeking, which is that high quality cancer care, and making sure that we deliver that. Historically, there's a lot in the history of healthcare as a whole and trying to drive forward health equity. We know about Tuskegee, and I think that has permeated and created an understanding within especially the Black population, that has unfortunately led to mistrust within that population that needs to be taken into account. I think, especially for us as providers, and being very sensitive, and especially driving forward cultural sensitivity. We must make our patients feel comfortable and understand their vantage point. The interesting thing about mistrust I want to bring to the attention here also is that this can also be a sign of strength, a sign of resiliency, right? It's a sign of actual self-preservation when we live in a world with multiple seen and unseen biases, especially those implicit biases. And it's a way of actually patients protecting themselves. And so I think as long as we as providers open up our aperture, go on the balcony, so to speak, make sure we don't get defensive and we put ourselves in others' shoes, I think that's definitely going to create safe spaces to address mistrust head on and make sure that patients feel comfortable. Really great question. So lot of historical context to take into account. A lot of it still applies today. And again, it's about making sure that we as providers, as those within the healthcare industry, make sure that we deliver that quality health care. And I think a lot of that is understanding where patients' perspectives are coming from.
Thank you, Dr. Gray, for sharing that. Definitely, definitely important factors that you mentioned there. Dr. Basu Roy, what do you see within patient groups in your organization?
Dr. Scott, that's a great question. And I'm going to go back to a point that you made earlier on when you were talking about today's session about being uncomfortable about having these conversations because with discomfort comes change. And Dr. Gray made this point about trust. And I think that's something we've heard through and throughout when we've talked to patients in our community. It's very obvious that minoritized community members, such as those belonging to the African American community or to the Hispanic Latinx community, patients from these communities, they tend to have much worse experiences with their healthcare providers as compared to their white counterparts. That's something that we've heard across. In terms of mistrust, I think the other side of mistrust is implicit bias on the side of physicians. And that is something we've heard from patients as well who belong to minoritized communities, such as those belonging to low SES, those with perceived low health literacy. They very candidly shared with us that the treatment that they receive from their physicians is fundamentally different. And I think these types of conversations about how we can bridge this gap between mistrust and removing implicit bias, I think is going to be fundamental in making sure that we bridge some of the gaps that Dr. Gray talked about.
Thank you. Thank you for sharing that. I wanted to just back up just a little bit. So we talk about socio-demographic and social determinants of health. When we say those words, what does it mean? Can you elaborate? Do you both want to elaborate on it? Either one of you is fine too.
Yeah, so when we talk about those terms, we're talking about not just the patient, sitting in front of you. It's taking into account their experiences, their life journey, taking into account what happens when they leave their house, right? If they're sitting in front of you for one medical condition, it's also taking into account their other comorbidities, their other medical problems, and it's really looking at the patient from a 360 standpoint. How do they need childcare at home um, to come into a visit? Do they need help with transportation? Do they have to take time off of work? All of those again are burdens that we as healthcare professionals need to take into account. And I think when we do that, we can actually the help to make the best, more personalized decisions for the patient. So it's really looking at things from a 360 standpoint, and making sure that not just you as the provider in the room with the patient understands that, but making sure that your whole healthcare team, that your social worker understands that your case manager, that your nurse, your physician's assistants, that your schedulers are looking at this through a very open lens.
And I'll
Great.
and I'll share my patient perspective on that, Dr. Scott, and I'll give a very simplistic definition of social determinants of health. And from our perspective, it is those things that a patient can't control. It's not in their hands. For example, where
Yeah.
they live. Do they have access to healthy food? Do they have access to healthcare? Do they have access to education? The environment that they live in, is it a very polluted environment? Factors that patients cannot control, but factors that fundamentally impact, to Dr. Gray's point, the 360-degree view of a patient's diagnosis and their journey.
That's great. I just really thought it was important for us to stop because we throw these words around and you will see like not much people know what it means. So it's just important to really just level set first when we're throwing these terms, what it actually means. So we just had a really great discussion on, historical barriers and its context and how it affects different populations of patients with cancer. We'll now dive into research and how it is navigated or intertwined in community and academic centers and why it's important in transforming cancer care. So more and more, we're seeing the importance of biomarker testing and the huge role it plays in cancer research. At Foundation Medicine, we've done quite a bit of ancestral research, revealing ancestry associated differences in genomic alterations in non-small cell lung cancer. Dr. Gray, what are some of the steps that you take first to understand how you want to approach your research questions? Tell us how you tend to navigate your research projects. Like when you think of goals for your research, is it to
Mhm.
help patients get more access, to help patients and their doctors learn more about treatment options? Share with us your take
Mhm.
on navigating your research.
Yeah, so I'm a clinical trialist. I really enjoy that space. And one of the reasons I enjoy that space is it is exactly what you mentioned. I drive forward every single day to impact the lives, not just of the patients in my sitting in my clinic, sitting in our waiting room at the cancer center here, but also nationally and globally. What can we do in order to better understand, right, what the opportunities are? What are we missing? Where should we go forward in the field? But also taking that action beyond understanding. How do we then implement drugs, agents, therapeutics,
Right.
genomics to change the standard of care? Impact lives, and making sure that we do it in a way where we are creating spaces where there's not just access for some, but for all, and making sure that on our trials, on our research, that we have proper representation, that we are not, again, that we're posing questions and answers that are going to be broadly disseminated across a population. And this is something that I challenge my research teams to do constantly. Um, okay, great. Let's track the research. Well, 90% of the patients right now that we have on the trial, we're about a quarter of the way accrued, are white. What do we need to do as a group to ensure that we're intentionally making sure that we are representing all of the patients that we see, right? All of the patients within the United States. So I thank you for that question. It's a really, really great question. Really made me take a deep dive and center myself about why am I here, right? Why am I doing this every
Why are you
single day?
doing
But
this? Right.
right, why are you doing this, right? Great
Yeah.
question.
Great, thank you. Dr. Basu, as someone who works in the patient advocacy organization in that area, how important is the patient's voice when it comes to research? How do you incorporate the patient's voice? Do they have a say in funding? Do they have a say about the research proposals that are being submitted? Because understandably, it impacts how they receive treatment or perhaps a new therapy that may be coming out. So share with us your take on that.
That's a great question, Dr. Scott. And as a patient advocate and as a scientist, I firmly believe that all the progresses that we've seen over the past 10, 15 years in lung cancer treatment and lung cancer diagnostics, they need to reach patients no matter where they live and who they are. And going back to your question about sort of engaging patients in that research life cycle, I think it's incredibly important to understand from patients themselves, first of all, how to reach them, how to
Mhm.
engage them, and thirdly, what is research that's pertinent to the patient community. And so we do that all the time as a patient advocacy group at LUNGevity Foundation. We involve patients right from the development of a research question, then
Mhm.
deciding what research to support. And the third piece being, how do we take that research and disseminate it into the community and create materials that are meaningful to the community that we want to serve?
That's great. Thank you so much, Dr. Basu, for giving us from how you're incorporating those to patients. Patients are key. It's why we wake up every day, right? We're trying to, make sure we help to transform their care. In speaking of research, Dr. Gray, you have extensive research, helping, you're very passionate about disparities in cancer care. And can you explain for us what is the Compass Initiative and what is the goal of this project?
Oh, yeah, absolutely. So, COMPASS, well, we'll start off with that. It stands for Community Outreach to Empower Black Patients with Non-Small Cell Lung Cancer to improve engagement and awareness. And you just heard from Dr. Basuroy how important it is to have patients involved in the research up front. And this is really a nested questionnaire surveys where we want to hear the patient's voice. It is part of a larger initiative called Justice, which is joining us together to improve lung cancer equity. And within justice is really a multidisciplinary, multifaceted network of individuals who have come together for a common collective purpose to better understand um, lung cancer in minoritized patient populations and really to drive the field forward for those patients. This is just one project that we're starting with, and hope to move this forward and take information that we have learned from this project forward. When patients are enrolled on the first aspect of justice, which is a clinical trial looking at evaluating not only immunotherapy, which is one of the mainstays for lung cancer treatment, but also understanding how a liquid biopsy, looking at your genomics, will influence those outcomes.
Mm-hmm.
For those patients enrolled, we're going to run these surveys at certain time points before you start on treatment, when you're on treatment, and after treatment, again, to really understand what is your engagement in this, what is your awareness, and what can we then take from that information and learn from it and build outward from it.
Great, great. Can you tell us how far along is the study and how
Mhm.
is it different from any of the previous studies that you've conducted?
Awesome. Yeah, so I'll start with the second one there because I think that's a really important point. As you heard me say, immunotherapy is a mainstay for treatment of patients with lung cancer.
Right,
And one of the reasons that is we've had multiple large-scale studies, registration studies that have been completed that the FDA has now utilized those to approve these therapies as part of standard of care for treatment of patients with non-small cell lung cancer. Unfortunately, when you look at those studies, they have a very small percentage of patients who are Black. We're talking single digit percentages, which is definitely lower than what we would expect when we look at our national percentages of patients that are Black.
right,
And it's something that we just think we don't understand very well in Black patients. Do we think that they benefit from immunotherapy? We do, there's interestingly, there's studies that say that Black patients do better with immunotherapy than, for example, white patients. There's studies that show that they do the same, and there's also studies that say they do worse. But those are all retrospective analyses. And what we have found is that in research, it's really important to minimize the biases that can come with doing retrospective research by doing it prospectively, by enrolling the patient before they start and following them along the way, and then you can capture that information. This is why the surveys are also going to be embedded within it. I think, where we are right now, the protocol is written, we're all signed off, and we're in that process of what we call study startup. So really setting the ground and laying that infrastructure so that when a patient comes in the door, we have everything ready for them to go. We have the treatment ready. We want to thank our pharma partners who are going to be providing the treatment. For full disclosure, we want to thank Foundation as well for being an active, engaged participant on this and helping us with the liquid biopsies for the patients so we can get that genomic information and have a better understanding. We want to thank LUNGevity and Dr. Basu and his team for helping us with the deploying these surveys so we can also get that patient perspective. So I think it's really, again, going to be, and it's really an exciting project. We're going to have such a richness of data studied intentionally in a population where we really have a gap and an opportunity then in turn to do better and to have a better understanding.
Thanks for sharing that, Dr. Gray. You mentioned Dr. Basu and thanking him there. Dr. Basu, can you explain the collaboration with LUNGevity and Moffitt? And, how would that collaboration benefit or impact current knowledge around disparities in lung cancer versus Moffitt just doing it on their own?
Now you're talking business, Dr. Scott. As Dr. As Dr. Gray mentioned, this is a very, very unique opportunity to learn directly from the community. Let's start with that. And let's also talk a little bit about why. So, when Dr. Gray reached out to us and said, you know what, Upal, can we collaborate on this? We were like, yes. And I'll tell you why, Dr. Scott. Is because of the fact that, going back to some of the original research that we'd done at the foundation, we sort of fundamentally identified a couple of key issues that we've heard from the patient community. One was the fact that even if a patient was on a targeted therapy, very often they didn't know that they had biomarker testing. So their doctors had not talked about them, of their tumors being tested, and that their tumors had undergone biomarker testing and that they were receiving personalized medicine. The other piece that we heard from the patient community was the fact that they love receiving information from their healthcare team, and their big pillar is the oncologist, and if not the oncologist, the bigger care team. They sort of see them as sources of information. Now from a foundation perspective, we sort of see two big pillars of care in a patient's journey. One is as soon as they're diagnosed, one is biomarker testing, and the second is clinical trials, access to
Right.
clinical trials. And when Dr. Gray reached out for this collaboration, we were like, oh my God, this is that opportunity to really unpack that patient perspective, that patient experience, both from a biomarker testing perspective and a clinical trial perspective. So that's, I think, fundamentally new about this project as well, sort of really looking at both biomarker testing awareness as well as clinical trial engagement. And the other piece here, Dr. Scott, which I think is also incredibly important, yes, we are conducting patient surveys and we are learning from patients, not just about how engaged and aware they are, but if not, why not? And how can we change that? So, really learning
Right.
from the patient community, how can we get them more engaged with their care, more activated, feel more respected, feel more included, both from a biomarker testing side and from a clinical trial side. But the other sort of really cool opportunity here is we will also be conducting physician surveys. Essentially, those physicians that are a part of this trial network who are also overseeing care of these patients, we're going to be asking them parallel questions about levels of testing. If not, why not? Clinical trial engagement. What resources do they have within their institutions to engage minoritized communities? So, this is that really cool opportunity to sort of learn both from the patient community, from the physician community, sort of in parallel, and triangulate sort of that information to really come up with, let's use the word toolkit here, to better serve the community.
Yeah, and I think that's a great summary. Can I just say it's really about
Sure.
driving forward with empowerment of the patients is our ultimate goal.
Yes, definitely. Definitely. With that being said, do you guys want to share any advice to your colleagues out there on how they can really help with, you know, eliminating the barriers around health disparity and just how changing the thought processes in their current practices? Maybe some advice to them before we close out today.
I think that's a really good point. I think it's about um, taking a pause, making sure that we listen, we hear, we pick up on the obvious and maybe those more subtle cues, right? I think when you're in the room with the patient, I always say you have about 5 minutes to really figure out how much information do they want to hear?
Right.
Who's who are their key decision makers? How do they kind of want you to approach the visit? We're really very focused on the patient journey. We are focused also on the what's that patient's voice within making a decision within their healthcare journey. And I think that that's where the pause and the listening, not only listening to the patients, also I would say, picking up on those cultural cues, using all the cultural competencies training that we've all undergoing, really using that to apply.
Right.
But also, there's the caregivers, there's the family.
Oh,
Uh,
that's important.
I think that paying attention there, understanding that I always have this saying in my clinic to my patients, you know, four ears is better than two. When a patient comes in without anybody, maybe right by their side, I always say, who are we calling today um, to even listen in on the visit? You can get very overwhelmed very quickly. We give a lot of information, and I think it's really again taking that pause. We're
Yes.
very busy in clinic. We can we even as healthcare providers may feel a sense of being overwhelmed. Oh, I have to get to the next patient and the next. I have to document. But being present, I think, is something that I hope is a take home message. And if I may, I want to highlight something that Dr. Basu Roy said earlier.
Hmm.
Goes to this about taking that pause, and this is really to the healthcare providers. It has been documented over and over again that Black patients are less likely to get genomic testing. And
Right.
on top of that, they are less likely, when they do get genomically tested, less likely to have a comprehensive panel done.
Mm-hmm.
Today, there are at least 9 markers within lung cancer that we really need to know in order to deliver the best healthcare possible and minimize um, toxicities also. Because if we get the order of the medications wrong, that also can impact a patient's outcome. So I thought that was a really good point that Dr. Basharoy brought up earlier, and wanted to just also take a moment to highlight that.
Thank you, Dr. Gray. Those were some top points. Key points. I just loved even how you said the caretaker, because sometimes, even if it's like the elderly patients, they're not going to remember, and then their caretakers or their families are asking them, well, what was said, or what was, and they can't relay, and it's just those missed opportunities for everyone to engage and help decrease these disparities. Dr. Basu Roy, if you want to share from your point any take-home messages for your colleagues.
I think Dr. Gray articulated beautifully. And thank you, Dr. Gray, for bringing up caregivers. I think there's a huge piece of caregiving which has a cultural connotation as well. Members of the Hispanic, Latinx community, caregivers play a huge role. So definitely keeping that in mind. And again, definitely 4 years are better than one. The other, I think, the big thing that I would also remind our colleagues out there is also to be okay feeling uncomfortable. I think we are all learning how best to serve our community, and we haven't yet figured that out. So I think having calmness in discomfort, I think, is absolutely critical.
Yes. Thank you guys for joining me today to have, as we say, some of these much needed uncomfortable conversations. But I hope our viewing audience has learned a lot. If you are interested in receiving more information, please be sure to visit the Foundation Medicine website, the LUNGevity website, and the Moffitt website. I want to remind everyone we'll now have a 15-minute question and answer. Please feel free to post your questions in the comments.
Thank you for having us.
Yeah, thank you. This is wonderful.